How do you fix Facet syndrome? Do you know?
No.
Okay. So we fix Facet syndrome by two different adjustments. There's several different chiropractic adjustments that can do that. First, and I think the best, because it not only affects the vertebra in Facet syndrome and takes that vertebra, that lumbosacral joint, out of hyperextension, because that's what Facet syndrome is, right? It's the bottom lumbar vertebra and the sacrum in hyperextension. A lot of it's from sitting all the time on your coccyx bone. So a couple of things you can do. One, you can get a sacral wedge and sit on that instead of on your chair, right? That little cutout piece in the tailbone area. So make sure you get a good one. My favorite is Relaxo Back. They make the best one. It's a dense foam. Second, we're going to do this technique, flexion distraction. So I'm going to place my hand right at about L4 there, right above the lumbosacral joint that's in hyperextension or Facet syndrome. And a lot of people don't know they have Facet syndrome. And again, you can tell by pressing all the way at the bottom of your lumbar spine where it meets your sacrum. And if you have sensitivity there while you're laying down, it's hard to do it yourself, then you know you have Facet syndrome. It's very common for people that sit down all day and have back pain right at the bottom in the center of the spine. If you press there and it feels like a bruise, you probably have Facet syndrome, especially if you sit all day in front of a desk or a computer. So this is what we do. I place hand placement down low. Again, this is Cox flexion distraction. So we're going to go ahead and take that lumbosacral joint out of hyperextension with this technique. And then after we do that, we're going to adjust her. So an actual manual adjustment to the sacrum is very, very effective, as long as she doesn't have any issues that prevent her from having an adjustment on her side, a side posture adjustment. So lay on this side, on your left side. This is a really effective way to take that lumbosacral joint out of hyperextension, take pressure off that nerve and the facet joints. So something you may not have known, the facet joints have tons of nerve endings. The most nerve endings you can find in the spine are right there in the facet joint. So those are the joints that connect the vertebra below to the vertebra above, okay? And we have facet joints, as you can see here, on the side, on both sides. Okay, take a deep breath in and blow out. This adjustment is not the Facet syndrome adjustment. This is her pelvis on this side, which is pulled back, and the other side up. This next adjustment here, I'm gonna place my hand on the bottom of her sacrum. Go ahead and flip over. And I'm gonna drive it forward and down, the opposite direction that sitting causes the sacrum to go. So I'm contacting right above the coccyx at the bottom of the sacrum. Take a deep breath in and blow all the way out. Good, and just relax here. Okay, and lay on your back and cross your arms in front of you. And that's how we fix Facet syndrome. And there are some exercises you can do to fix Facet syndrome long term. Make sure you check out that video. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.